Good morning, everyone. I'm very pleased to be invited to speak here about abortion and mental health. I'm speaking again in the afternoon. So this morning, I'm going to focus mainly on the evidence for associating abortion and mental health together, because unfortunately we're hearing that it is increasingly the grounds under which abortion is being given across the world and potentially in Ireland. The relationship between abortion and mental health is really quite complicated, and I'm going to just think a little bit about why we would talk about offering somebody an abortion on mental health grounds, and what the evidence might be that actually demonstrates that this is a good idea, or that it's safe for women, or that it doesn't bring any harm with it. So we're going to look at both the literature and clinical practice. The reason this even ever came up is, of course, because of the X case. Now, I'm not going to go into the legal side of things in any detail because we will have legal speakers later. But as you all know, this was a 14-year-old girl who was the victim of statutory rape, and the High Court requested an injunction, the Attorney General requested an injunction from the High Court, which was then appealed to the Supreme Court. The grounds on which this girl was looking for a termination were that of suicidal ideation. But there were major difficulties in terms of how this was actually presented and how the assessment was delivered. First of all, it was based on the testimony of a psychologist, an adult psychologist, whose expertise, I believe, was in sex therapy, who had not actually assessed the girl at all. He had never actually even seen the patient. There was no expert medical testimony, and certainly the degree of care and psychological and psychiatric care for this girl seems to have been sorely lacking. Anyway, as you all know, the ruling was that there was a real and substantial risk to her life due to her suicidal ideation, which was on the most tenuous of grounds at best. And subsequently, the referendum to exclude suicide as grounds for abortion was rejected.
I'm just going to move this a bit nearer for you.
Oh, sorry. Apologies. Subsequently, of course, we had the Protection of Human Life in Pregnancy Act, and as you know, that included the risk of life and suicide in it, where there is, again, a real and substantial risk of life, a risk of loss of life to the mum, and also, in this case, 3 medical practitioners, 2 psychiatrists and an obstetrician would need to be involved to review the case and to agree that this was appropriate. The numbers have been very small since 2013. There have been 7 in total, which suggests that maybe this isn't the most widely used grounds in Ireland at the moment. When we look at the proposal that we're getting, if this referendum, if there is a yes vote, if the 8th is repealed, we're looking at, again, termination of pregnancy where there's a risk of life, a risk to the health of the mum. That 2 doctors see the patient, and they don't specify who they are. 1 medical practitioner in an emergency, and again there is very little definition of what might constitute an emergency. Is a patient turning up to the emergency department and saying they are suicidal? Is that an emergency? I consider that to be a psychiatric emergency, but would that be considered an emergency under the Act? Quite possibly, because the general scheme makes no distinction between general and mental health of the woman. So the situation, as has been described in the UK, is that about 98% of the 190,000 abortions that happen every year, 94% of those are due to mental health grounds. Very poorly defined mental health grounds, which probably would be more correctly described as psychosocial grounds. If you think about it, if there are 94% of those women, you're looking at nearly 180,000 very mentally unwell women in pregnancy. Is that really, does that sound likely to you? I was recently at a Royal College of Psychiatry perinatal faculty 3-day update, designed for consultant psychiatrists who work with pregnant women, who look after women in pregnancy in the perinatal period and provide care for them in that period, updating us on the safety of medications and how to provide the best care from the Royal College, which is, you know, the leading organisation for psychiatrists in the UK. Given that allegedly 180,000 women are profoundly mentally unwell or very suicidal in pregnancy, can anybody here guess what proportion of the time was dedicated to talking about suicide in pregnancy or the need for abortion in pregnancy? Do you think maybe 20%? Hands up, who thinks it might have been 20%? Anyone for 10%? 0%. 0% of the time in this 3-day update for specialists looking after pregnant women and their mental health care was devoted to talking about abortion. It is not routine perinatal mental health care. This is not something that anybody considers to be a good idea. This is really alluded to quite overtly on the BPAS website, and as you can see there, they make it quite clear that they use the kind of the softest criteria that are available. It happens to be mental health grounds because there are no criteria there. There is no need for an assessment. There is no need for anyone to actually assess the woman. There is no need for anyone to actually provide mental health care to her. Instead, it's literally just a grounds to sign the forms, get the termination done, and everyone moves onwards. There is no requirement in our proposed law for assessment of a suicidal woman. And as everybody here in the room, most of you are doctors, most people work in the healthcare professions. If you see any other suicidal person, if you are concerned about their risk of suicide, you don't just prescribe a random procedure that's unrelated to their suicidal ideation. You refer them for an urgent psychiatric assessment. You get them seen at their community mental health team or by somebody like myself in an emergency department. I work in an emergency department. We see people, I'd say probably up to 10 people every day who are either suicidal or have just done something pretty horrible to themselves. So we see a lot of people like this. And what happens? They get an assessment, they get a full mental health assessment by either a psychiatrist or a specialist mental health nurse from one of the national clinical programmes working under the supervision of a psychiatrist. This is best practice. Why would we not be requiring that somebody have an assessment if there is an actual genuine concern about their mental health? In terms of the evidence now, if we go onwards to actually the hard evidence, there is nothing at an RCT standard, obviously. You cannot randomise women to abortion or no abortion. That's just not ethical. So the standard of proof is slightly lesser. We're limited to case control studies, cohort studies, large epidemiological studies, and of course systematic reviews of these studies. Some studies show some harm, some studies show no harm, and they're even conflicting on systematic review. So what I'm going to do now is I'm going to talk about the 3 most seminal papers in this area that you will hear talked about a lot because they're quite popular and they're quite some are quoted more than others. And then I'm going to talk about the 3 important systematic reviews in this area, only one of which you ever hear about in the media. So when you look at the relationship between abortion and mental health problems, there are 3 ways that you can look at it. So pretty much all studies are agreed that abortion is associated with mental health problems. The nature of that relationship, however, is very unclear. Is it that abortion causes mental health problems? Is it that the mental health problems are in fact due to the unwantedness of the pregnancy? Or are both abortion and mental health problems due to some common third factor, a confounder? Are they due to poverty? Are they due to domestic violence? Are they due to various other things that happen to be going on in a woman's life? We know that these risk factors have been established. A history of mental health problems is one of the strongest predictors of having mental health problems after an abortion. Younger age, women who are ambivalent about having an abortion, those who are coerced, late-term abortions, abortions for fetal anomalies, people who have children already, women who have poor supports, moral objections, or multiple abortions. Okay, I'm 2 minutes, so I'm actually going to skip through the next 3 papers, and we are going to concentrate on the systematic reviews because they are the most important. The first one that you hear about, and this is the one that was mentioned extensively at the Oireachtas committees, it's the systematic review that was published as a report, not in a peer-reviewed journal, republished as a report by the Academy of Medical Royal Colleges back in 2011. They looked at all of the studies in the area and they found there was no increased risk following abortion compared to live birth. They found that similar factors were associated with mental health problems in both people who had an abortion and those who delivered live babies. They found that in women who had abortions, if they had pressure from a partner, negative attitudes, or a personal negative experience of the actual abortion process, they were much more likely to develop mental health problems after an abortion. And they acknowledged that there were higher rates when they included women with previous mental health problems. So they acknowledge that people who have previous mental health problems are particularly vulnerable to developing mental health problems after they give birth. The second systematic review was also published in the same year. This was in 2011, as I mentioned, and this was done by Priscilla Coleman, who's a US-based researcher. This paper, by contrast, was published in a peer-reviewed journal, unlike the other one. She looked at 22 studies, all of which included at least 100 women. In total, they had 887,000 women involved. They found that there was an increased risk of 81% of mental illness following abortion when they controlled for common factors compared to birth as well. So they found that there was an increased risk, particularly of alcohol use, cannabis use, and suicidal behaviours and suicide in this population. So given that there were two systematic reviews, both of which were saying completely different things from the same body of studies, David Ferguson, who's a very well-known researcher from New Zealand, he's done a lot of work in cohort studies following women over 30 years and looking at various health outcomes, including mental health problems following abortion. So he wanted to have a look at this and just to examine, are there any therapeutic effects of abortion which might mitigate these established adverse outcomes? So he went back and he looked at these two systematic reviews, and he agreed, first of all, that there was no evidence that abortion reduced the risk of a woman developing a mental health problem. It didn't help her mental health problems. There were no therapeutic effects. And he agreed with Priscilla Coleman in the second systematic review that there were increased risks of anxiety, alcohol abuse, drug abuse and suicidality. The anxiety increase wasn't statistically significant, but the substance abuse and suicidality ones were. In conclusion, there is no evidence that abortion is of benefit to women's mental health. There is no evidence that abortion reduces the risk of mental health problems. There is no evidence that abortion is evidence-based care for women in a crisis pregnancy. There is evidence of harm, and the highest risk is obviously with women who have had a previous history of mental health problems, who really deserve much better health care than just being offered an abortion. And the highest risk is for substance abuse and for suicidal behaviour, both of which are very high risk and associated with poorer outcomes in the long term. So finally, last slide, there is no evidence from any studies or from clinical experience anywhere that abortion is a treatment for suicidal ideation or any form of mental disorder. Sorry for going over time. Thank you.